The world marks April 7th as the International Health Day. This anniversary comes when the healthcare system in Yemen has collapsed because of the war. Most of the health sector's infrastructure has been demolished by ongoing atrocities of the conflict. The following report has more details.
Yemen's health sector has been hit hard by the country's long-running armed conflict, economic deterioration, and institutional breakdown. Under the strain of fighting, the availability of a functional health infrastructure has dwindled. Only half of health facilities are fully operational at the moment, and more than 80% of the population has problems gaining access to food and drinking water, as well as health treatment. A shortage of resources and supplies has severely impeded healthcare services, and the conflict has paralyzed healthcare governance. Yemeni health reports detail the country's worsening health problems. High levels of child malnutrition, poor vaccination rates, and outbreaks of transmissible diseases are also mentioned in the studies. The increasing crisis affects mothers and children disproportionately, with the newest data predicting that one mother and 6 babies die every couple of hours. Access to high-quality prenatal and postnatal care can mean the difference between life and death for both women and their unborn children. Healthcare workers report that they are understaffed and that they lack essential equipment such as incubators. Meanwhile, pregnant women, new mothers, and newborns are regularly forced to share beds, and infection control measures are inadequate. Yemen has had a number of illness outbreaks in the recent years, including cholera, diphtheria, and more recently the COVID-19 pandemic, adding to the country's already fragile healthcare situation. The rate of COVID-19 vaccination is strikingly low, with only 1.1% of Yemen's population fully vaccinated. The longer the pandemic draws out, the more burden will be placed on under-equipped hospitals and overworked medical personnel, as they fight to keep up with an inflow of patients in need of specialist treatment. Health employees are already subjected to inconsistent pay, staffing shortages, and chronic stress. Reduced foreign health financing, as well as unprecedented pandemic outbreaks such as COVID-19, raise concerns about the future of healthcare in Yemen. Such epidemics have harmed Yemen's unstable health system, putting significant pressure on the country's under-equipped institutions and health workers. Hospitals are severely underfunded, and a lack of beds mean that a significant number of individuals are turned away and forced to care for themselves. Due to a shortage of funds, healthcare staff are underpaid and under stress, barely able to pay the bus fare to the hospital. Yemenis who have been fortunate enough to flee the ravages of violence are tormented by the fear of sickness. The international community must fight harder than ever to keep Yemen's people safe from dangers that have plagued them for so long.